tell you this, one of the good things, if there is anything good with cold and flu season, some of the things we've talked about is the same for those who have any other chronic illnesses or challenges. Now, for that particular diabetic that you're talking about, or someone with heart disease or other lung diseases and so forth, we have to be a little more careful, right?
Mm-hmm.
We want to make sure that we're considering things that are staying out of larger areas. Some of the things that we talked a lot about with COVID and spreading things and that sort of nature. The other thing you want to do is make sure that you're compliant with your medications. Let's make sure that we know where we are. For that diabetic, I need to know that your A1C is well controlled. Because if you're not well controlled and your blood sugars are high, guess what? You're set up to get sicker than someone like myself who doesn't have sugar challenges.
Yeah.
So when you have these chronic challenges and so forth, realize that I almost like to think of you as having an extra force field around you, that we need to think about that, like when you're in these big groups and so forth. So you can recognize, like, what else do I need to really make sure that I am being safe with when I'm dealing with the chronic illnesses? And most of it gets back to managing the chronic illness well, because we don't want inflammation. Inflammation in our body, everyone, causes what I call dis-ease. And so we need to keep that inflammation down, and especially during cold and flu season with something like diabetes, other lung diseases, or heart disease.